Hi, I'm Dennis Petrie.
And I'm Helen Dickinson, and we're the joint leads of the Centre of Research Excellence in Achieving Health Equity for All People with Disabilities, also known as AHEAD. In this short clip, we're going to tell you a bit more about the vision and aims of AHEAD. So, Dennis, let's start with a big question. Why is AHEAD important?
Thanks, Helen. Well, 4.4 million Australians live with disability and have worse health compared to non-disabled peers due to avoidable reasons by being disadvantaged across a number of areas, including health promotion, healthcare, employment, and housing. For example, Australians with disability are more likely to face underemployment, 13% versus 7%, and higher unemployment rates, 10% versus 4%, than their non-disabled peers. They are also more likely to be daily smokers, 23% versus 12%. This is perhaps not surprising, as often as a society we fail to see things through a disability lens when we roll out major initiatives, including for public health. Despite significant government spending on disability policy over the past decade, a number of these inequities have stayed the same or even widened. These inequities are not inevitable. Similar countries are achieving better outcomes. AHEAD aims to develop evidence-based interventions that can help address these inequities and deliver greater health equity for Australians with disability. So, Helen, who is going to be involved in AHEAD?
Thanks, Dennis. I think it's pretty fair to say we're really excited about the team we've brought together. AHEAD builds on the work of the Centre of Research Excellence in Disability and Health, the CRE-AHEAD, and that ran from 2017 to 2024. And we did significant work to document the health inequities that people with disability face. AHEAD involves some of the team from the first CRE and also expands this with new skills and capabilities. AHEAD is lucky to be funded by the National Health and Medical Research Council, the NHMRC, and is going to run from 2025 to 2029. AHEAD is a partnership between Monash University, UNSW, University of Melbourne, RMIT, University of Sydney, and ANU, with a number of different national and international associate investigators. So we bring together researchers from a number of different disciplines like epidemiology, health services research, public policy and administration, and health economics. And that's really important because we need a range of different skills to understand the major drivers that impact health outcomes of people with disability. We're also going to partner with a range of people who bring perspectives from policymaking, service delivery, and really importantly, people with disability, to gain a more full picture of how we move health inequities and make sure that any recommendations we make are appropriate, practical, and implementable. So, Dennis, tell us now, what's the vision for AHEAD?
Well, Helen, AHEAD aspires to create a future where disability inclusive research drives real world solutions that break down barriers and create lasting opportunities for people with disabilities. By encouraging the implementation of sustainable co-design strategies that address the social determinants of health, AHEAD will enhance health equity. AHEAD also aims to further develop our capacity in Australia to deliver world-class disability research. Helen, can you tell us a bit more about what AHEAD will be working on?
Sure, Dennis. So AHEAD's got four core research streams. These are healthcare, home, work, and the NDIS. And we've chosen these streams because they're all areas where government spends substantial money and where we think policy levers can be identified to make change happen. Importantly, also these areas need to be able to work together if we're going to be able to address health inequities. So we'll have a number of projects that are led by AHEAD's researchers and PhD students that sit within these different themes, and also across these to identify how we can address health inequities for Australians with disabilities. These research streams will also be supported by four cross-cutting research hubs. The Lived Experience Hub will engage people with disability, researchers with disability, and disability advocacy groups to make sure the priorities, views, and values of people with disability are at the forefront of the research agenda for each of those streams. The Policy Review Hub will help to identify and analyse the suite of policies that have implications for the research streams. A Data and Modelling Hub will help examine which potential interventions will be the most impactful and provide the best value for money. And the Knowledge to Action Hub will help to ensure that any knowledge and insights generated through AHEAD's work is implementable in practice and our findings are communicated appropriately. Working in this way, we think we can deliver research projects that create new knowledge on how disability resources in Australia can be optimally reallocated and identify and demonstrate how health and social service delivery can be redesigned, and also work with our partners to mobilise this knowledge into policy and practice. So you can see us developing things like accessible fact sheets and decision support tools, running series of public webinars, policy forums with key government policymakers, and making submissions to government inquiries. So if people are interested in this, Dennis, how can they find out more about AHEAD?
Well, they can follow us on LinkedIn, subscribe to our updates, or send us an email at ahead@monash.edu. We hope that you will all join us on this journey towards achieving health equity for all people with disabilities. Thanks so much for your time.